So we are going to run through ANMR on the horse. I'm going to do it based off of this flow chart, which is something that I uploaded into the course. But I do want to say ahead of time that if for some reason there's some issues with the horse maybe being afraid of us working up near the ears or in the neck, or whatever might be going on with them, if they have some kind of injury there, we don't have to do it in this order. We can skip around and we can skip entire areas if we need to. The most important thing is that we get some of it done because it will have a positive impact. But if you need to modify this, you can. This is not set in stone, but I'm going to run through it in the order that it's shown and show you each step as a demo. So, for starters, we have this tool, and I'm going to start us off on the highest setting, which is all the way up to the top, but then I'm just going to back it off a little bit. Now, what I like to do with these horses is when I use the tool on them, if they're hyper reactive, I might back it off a little bit more where the setting's a little bit lower, not as intense. If I'm not getting any reactivity at all, I might put it on the highest setting. So it just kind of depends on how the horse reacts to it. But we'll start up at Atlas, which is the first cervical vertebra. We're going to hit the wing of Atlas. I like to start on the left side of the horse just because most horses are accustomed to people handling them and doing stuff on the left. But it doesn't matter. You can start on the right side. That's not a big deal. If the horse is more comfortable on the right, go ahead and start there. Start up here, and I'm going to run down now the rest of the cervical vertebra. Now what I'm doing is I'm actually putting motion into the transverse processes. When we worked on the dog, we put motion onto the spinous processes, but you can see with horses they have a lot of tissue here. They have muscles, ligaments, this big nuchal ligament that's blocking us from getting to those spinous processes since the spinal column lays in this direction. So we're going to hit those transverse processes that come off of it. So we're going to put motion into C1, and then we're going to go down each cervical segment, and we're looking for that involuntary twitch. Now Drifter's not showing us any, which isn't surprising to me just because he's my horse and he gets this done pretty often. So I wasn't really expecting to see a whole lot on him. Oh, there we go, we got a little bit of twitchiness right there because I just turned it up to the highest setting. But now what we can do is I'm going to use this tool to rapid fire it in the soft tissues to give it a little bit of a release. The other option is to just go ahead and take that massage gun and use it here. We can do that too. Then we're going to do another pass, and we want to see that twitch go away, which it did, so that's awesome. Even if it didn't, we would wait and kind of come back at the end of the session. We could do some other things there if we needed to, like some other soft tissue releases, gua sha, we could do cryotherapy, we could put kinesiology tape on it. There's a bunch of different modalities that we could utilize. But so you want to make a note of what you found and if there's areas that didn't release, so you can follow up with some other modalities following this session. So now we're going to hop over to the other side. And again, just keep in mind if the horse is not familiar with you using this on it, just because they're okay with it on the left doesn't necessarily mean that they're going to be okay with it on the right, so just go slow with them. Start up at Atlas, and we're going to go down, and you see you got a couple twitchy areas there. So we're going to rapid fire this in soft tissues. We're going to check it again. That actually looks a lot better. I'm just going to do a little bit more release, just because. Check it one more time. That's good. That looks good. So I'm going to hop over to the withers. I'm going to go back to the left side. Now when I get to the withers, instead of continuing to hold the tool like this, which is going to put a lot of pressure on my wrist, and it's going to be difficult, I'd rather hold it like this with two hands. We're going to start up at the top of the withers, and we're going to work our way down. And again, we're just looking for any of those involuntary twitches. Tiny little bit there, but not too bad. Good. That actually looks pretty good. So I'm going to use this now just to do some releases on either side. I'm going to go ahead and put some motion into it again. And that actually looks really good. So that's good. I mean, at this point, you could be done with this part of the back. If you wanted to do a little bit more of the soft tissue release, that won't hurt at all. But that's good. It cleared out, and that's what we want to see. So we can also run it all the way down the sacrum of the horse. And he does get slightly twitchy through this area, but we'll come back to that. What I'm going to do now is I'm going to try to square him up so we can look at his pelvis. weight down on that. Just make sure I'm staying in order here. Okay, so now if we look at the back of him, we want to look at the very tops of the pelvic joint, and we want to see if one side looks higher than the other. Now, right now, he's not standing completely square, but to me, he looks fairly even. I'm just going to put a little motion into both of these and see if we have any reactivity, which we do not. So that's a good thing. Let's say that we did have reactivity though, and this was a high hip. What I would do is I would pick up this leg, and I would go ahead and put motion down into that, and then we would do back there, and that is the release. Now we can also take this and we can take the tool and we can work along the hind end muscles, which is really helpful. But for right now, instead of using the massage gun, I'm just going to show it to you with this, but you can do the massage gun there too. Now if it was an inferior hip, we're going to come up this way with it, and then back there as well in the ischial tuberosity. Now what I also like to do, he's lifting his tail up for us here, is we want to check the sacrotuberous ligaments. So up under the tail on either side, on this side and that side, we can palpate those sacrotuberous ligaments. So we're just going to push in and up, and it'll feel like a rubbery string or like a rubber band in there. His actually doesn't feel too bad. When it's tight, it's easier to feel. But what happens when it's tight is it can pull the pelvis off center. So we want to release that so that it can sit where it's supposed to. Just gonna check this side. So again, I can feel it more so on this side, but it's not super tight. But if it was, I can put motion into it with my fingers, and at the same time I can go down the sacrum with this tool, and that just helps release it a little bit quicker. But if you don't want to use the tool, you can also just do it manually with your fingers. So now we'll actually come to the front of him. I think it's scapula's next. Yeah, remove the scapula. Okay. So you can check to see if one side is higher than the other, and you can do the release based off of in the course where we talk about the superior inferior release. But what I've found is that a lot of horses tend to get tight in this area, so I like to just do a general scapular release with everybody. And the way that I do that is I'll just kind of run the tool around the scapula, and then I take the front leg and I stretch it forward, and I do it right in this area. And a lot of horses are super tight in here, and it'll really kind of twitch a lot when you do it. So you just want to do it a few times until the twitching starts to go away. Some horses want to really push into it and stretch that front leg. And we'll just put that down, and we'll do the same thing on the opposite side. So I like to do that with every horse regardless of what's going on height-wise with the scapula. So then we can actually come to the front of the horse. And I don't do this one on every horse normally when I work on them, but some horses do have issues in this area. So you can look at the pectorals. If one side looks like it's a little bit more built up than the other, which his kind of does, he looks a little bit like he favors the right side. Sometimes, in some horses it's easier to feel it than others. He has a really muscular chest, so it's kind of hard, but you'll see some other breeds of horse, you can really see that sternum bone sticking out a bit easier. But a lot of times it'll be off center, so what you can do is release the pectorals by putting some motion into them, and then you can also put motion directly onto that sternum bone, and we just want to see that become a bit more symmetrical. Now the next thing that we can do is we can put a little bit of motion into the TMJ. So now one thing is we can look at the horse's teeth, and if there's any kind of asymmetry, like it's getting pulled one way or the other, then that can be an indication that the TMJ is off. But also they'll usually have a little bit of reactivity when we put motion into it. So I'm gonna put this on a lower setting just because this tends to be a sensitive joint, and I'm just gonna go up on the jaw And then I'm going to go on the back side of it and then right down the TMJ joint. And I'm looking for that little pathological reflex, which he does not have, which is a good thing. That means his teeth are probably pretty aligned. We're going to do the same thing on this side. And again, he looks pretty good, so that's good. Oftentimes I've found that if there is a TMJ issue, they're usually reactive in Atlas too, because there's a correlation between those two. And oftentimes they do have teeth issues, so you'll have to have the equine dentist come out and see what's going on there and do some work on those teeth. Let's see what else. I think we go down to the tail now. So now we can actually go to the horse's tail. And for this one, we're just going to start up at the top of the tail, and we can go down each tail segment. Just like that. You can also do a bit of a tail stretch, which in turn helps put a little bit of traction into that sacrum. Just put a little bit of weight on it. Look at his face, he's kind of falling asleep. He likes the way that feels. Just go ahead and release that. And then the last thing we can check is their knees, which is actually their carpals. Their knee is the equivalent of our wrist, and they have 2 rows of carpal bones here. So when we pick it up, ideally we want to see no gap in between there. He's got a little bit of a resistance there. So we're going to put some motion into those carpal bones by stretching it forward, and we're going to use the tool to go along the carpals. Then we're going to go ahead and check his range of motion again and see how we get a much better range of motion now, because we don't want that gap. We don't want to be able to see through there. So we'll do the same thing on the other side. So again, we're looking and pretty good. I mean, not horrible. He's got a little bit of resistance. So put some motion into that knee. And again, we're going to come back up, check it again. Looks pretty good. All right, so that's pretty much the full flow chart protocol. Like I said, it can be modified based on the horse's needs. So feel free to change it around. It does not have to be in that particular order. And if there's certain steps that you need to skip, that's totally fine too. If you have specific questions about a horse that you're working on, just reach out and we'll let you know the best way to do it. Thanks for watching.